We are going to examine the posterior thorax and the anterior thorax of the patient. The patient should first sit in upright position. The order of examination is in 4 ways. The first order is the inspection, second one is palpation, third one is percussion, and fourth one is auscultation. By the order of these four, we are going to examine the anterior and the posterior thorax of the patient. We are going to examine the posterior thorax of the patient. Here in the center is the vertebra, spinal cord, and both side there is right and left side, both sides the lungs are there. Till the 10th level of the vertebra, the lungs is there. We are going to now do the inspection and palpate the posterior of the thorax. Now we will perform percussion. For percussion, you have to take your left hand middle finger and other finger should be in a flying state, and you have to tap with your index finger of the right hand on the middle finger of the left hand, as I am doing in the diagram. We can hear three types of sound. First one is dull or third like sound, that is normally heard over a dense area such as heart or liver. Second one is the hyper resonant sound, that are louder and lower pitched than resonant sound, are normally heard when percussing the chest of the children and very thin adults. And third one is a tympanic sound, that are hollows, high drum like sound. Tympanic is normally heard over the stomach, but it is not a normal chest sound. Now we are going to auscultate the posterior thorax. I will ask patient to put his right hand on the left shoulder and left hand on the right shoulder, so I can get the posterior thorax clearly and I can check it easily. The heartbeat sound and the breathe in and breathe out sound will come perfectly on the back side of the posterior thorax. With the help of stethoscope, I will check the sound. We are going to use the auscultation pattern of checking as shown in a diagram of later. The thing should be noted that on the both side, left and the right, the sound should come exactly the same as similar. The same we are going to perform for the anterior lungs examination. For this, patient should sit in a straight front position. Here is a trachea and sternum. After that, the side is the clavicle on the both side, left and the right. And now we are going to palpate the frontal portion of the chest. Now we are going to perform auscultation of anterior thorax. Sitting in the normal position of the patient. Patient should breathe normally, breathe in and breathe out. With the help of stethoscope, we will check the sound of normal breathing and breathe out, as same as we did in a posterior thorax. Here also we are going to use the auscultation pattern as we used in a posterior thorax and the diagram as shown before. Things to be noted is the sound should come both sides similar and clearly.